Right. All right, hopefully we're live now. We're discussing Donnie Darko. We are viewing Donnie Darko through the lens of a psychiatrist and have step one made a commitment that we believe the film is about a psychotic dissociative process. And as part of that, we are choosing to work from a position of schizophrenia. We've identified the 5 inclusion criteria for schizophrenia and further identified that Donnie Darko does demonstrate at least 2, if not 3, of those 5 signs, specifically hallucinations, perhaps delusions, as well as a negative symptom, anhedonia, blunted or flat affect. At this point, we further appreciate that this condition is a diagnosis of exclusion, and we have listed 5 disorders that the American Psychiatric Association mandates that we investigate and rule out in order to rule in schizophrenia. And now we're discussing whether or not there is any evidence to support any of these 5 other mental disorders. Anyone? As we have previously named them, they include a substance-induced psychotic disorder, a psychotic disorder that is due to another medical condition, a schizoaffective disorder, a primary mood disorder with psychotic features, or an autism spectrum disorder, or ASD. Any evidence?
He takes his 2 prescription medications like right in the beginning, but he takes 2 pills, so I'm not sure what the medication is that leads to 2 of them.
So if we observe Donnie Darko taking medication, and it looks like he takes 2 separate medications, it is probably reasonable to assume that a prescriber has not diagnosed a substance-induced psychotic disorder, or that due to a medical condition. Right? He's taking medications.
They took 2 from the same bottle. So I'm like, what medication was it that really?
So the 2 pills are from the same bottle.
Yeah.
Okay. So if we rule against a substance-induced psychotic disorder and that due to another medical condition, is there an autism spectrum or schizophrenia or schizoaffective disorder that would require 2 tablets daily? I mean, the only thing that comes to mind, the initial thing that comes to mind, is that whatever his condition is may be severe enough to require a higher dose. Right? But I don't know if the second pill gives anything away here. It probably rules against autism spectrum disorder. But whether it's a primary mood disorder versus schizophrenia versus schizoaffective, not sure. Not sure. He takes it in the morning?
Mm-hmm. Right before right before he, like in the beginning of the movie, right before he goes to bed. His sister makes a crack about how he doesn't take his medication in the morning. So then he goes to the bathroom and actually takes 2 and he goes to bed.
So what I was about to say, which now is wrong, is that if we had observed this occurring in the morning, then it would not likely have been an extended release medication that was sedating. So lithium and valproic acid would be off the table. But since it's taken at night, we still have to consider that a mood stabilizer, therefore a primary mood disorder called bipolar disorder, is still in our differential. Any other support for or against schizophrenia versus schizoaffective versus a primary mood disorder? I mean, the antidepressants that are usually prescribed at night, which is Paxil, paroxetine, because it sometimes can be sedating, I guess could be given as 2 separate pills. It's a high enough dose.
Here's a fan.
Huh?
Here's from the Reddit fan.
Go for it.
We get a small glimpse of the pills Donnie's taking, and the only part that's visible is epin.
Yeah.
Oh, okay.
So they think it's doxepin,
Yep.
which can induce hallucinations, according to.
He takes 2 of them.
Doxepin.
Why would he take
So it's PIN or PANE?
PIN.
Okay.
Clonopin? What is it?
I don't know, would it say Clonopin versus clonazepam?
It's like clonazepam.
Yeah.
Yeah.
I think it would say.
Where's our pharmacy student?
When,
I could check.
A general question is that, well, yeah,
They usually won't even.
It'll say the
It'll say the
generic
generic.
name.
Don't say the
It'll
name.
say the generic name.
Are you saying
on the
like?
pill itself?
No.
No,
on the
on-
bottle.
yeah.
The bottle
It's on the
is-
bottle that it says
the
It's on the
label
bottle.
Yeah,
On the bottle.
yeah.
That's how you know it's a prescription.
Okay. Is there a parenthesis at the end of it?
No.
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 I paused the
So
film to
then-
look at it.
It would say the generic.
All right, so we're thinking doxepin.
I'm thinking doxepin.
All right, which is an older medication. It's a tricyclic. When the board asks about a tricyclic, there are 3 criteria that you need to look at your clinical vignette and ensure are there for you to be able to choose the tricyclic as first-line therapy or your single best answer. Number 1, there has to be an indication. That's obvious. However, more than half the time, the indication will not be major depressive disorder. So you have to appreciate that the tricyclics have alternative indications because you're about 60% more likely to have them presented in the clinical vignette. Right? Can you name a tricyclic, whether it's a brand or generic, and an indication it has through the FDA that is an alternative to depression?
Okay, amitriptyline for migraines.
Amitriptyline for migraines, good.
The one for OCD is like
Clinical.
Clomipramine.
Yeah.
With INE, yeah, but clomipramine for OCD, exactly right. Any others?
For neurosis, there's imipramine.
Imipramine for nighttime enuresis.
And fibromyalgia is
Yeah.
I have to look to see if there's actually an FDA approval for that, though. It may be, I have to look into that. Imipramine also, panic disorder. Again, that's INE. Now, the thing about doxepin is that it is heavily anticholinergic and heavily antihistaminic. So it can be prescribed in allergy and immunology. Systemic mastocytosis, which I don't report Donnie has per se, but that's something that comes up on shelf exams. The high potency of antihistamine, anti-H1, as well as the anti-M1, muscarinic, side effect of the doxepin. So maybe he is on doxepin. Maybe he is depressed. Now, if so, I think there's significance to this movie in terms of how real it is as a fictional case of first break psychosis, in that on many occasions, individuals Donnie's age, around 17 years of age, who present with the prodrome to schizophrenia are misdiagnosed as having depression because the prodrome looks like a major depressive episode. Social withdrawal, blunt or flattening of affect. But because of the mistreatment, because of the later diagnosis, the individual at some point, 17, 18, 19, certainly up to 25, then presents with frank psychosis because they're on medications like doxepin and not olanzapine, not haloperidol. And that's what may be playing going on here. So prodrome of schizophrenia looks very similar to a major depressive episode and certainly accounts for the significantly high incidence of misdiagnosis or at the very least late diagnosis. And Donnie's being an antidepressant instead of an antipsychotic, for which looks to turn out to be the first break psychotic episode of schizophrenia, is clinically relevant. She is providing psychotherapy as well, which again would be indicated in someone who's depressed, but not indicated in someone who has schizophrenia or a psychotic disorder. There is one form of psychotherapy that has been empirically proven to improve outcomes in individuals with schizophrenia, And this question comes up all the time on tests, including self-exams. What is that form of psychotherapy?
Is it family therapy?
Yeah. Family therapy for schizophrenia, which not only does she not employ, but the way she actually incorporates the family into the treatment planning is horrendous. I mean, it's a fumble. We're looking at 115 or 130?
1:30.
Yeah, sorry.
130? All right, so at 115, give me just a little signal, right? Somebody thumbs up that we're heading to the 10-minute mark. So 130 is the start, they're going to get out of here by 115, right?
No,
Two.
two.
Ah.
So, yeah, 1:30.
Anything else with regard to Donnie's condition? Do you like the
Yes.
psychiatrist?
Not great.
Not great. No, not great. Yeah, there's certainly some ethical issues here. Certainly some problem. I mean, he does appear to demonstrate an imminent danger to self or others, where others does include property. And she really doesn't do anything about it, which is unfortunate.
So she failed the Tarasov mandate, or
In a way, yes. Remember, Tarasov, even though in a civil rights case, others does mean property. In Tarasov, it means person only. I don't know if the Tarasov has ever been applied to property, but certainly you think that it could.
so he has sleepwalking issues too.
He has sleepwalking issues. Yeah, I said movie stars. He definitely has sleepwalking issues. Again, is that, I mean, individuals with schizophrenia, especially the prodrome, again, further supporting why the misdiagnosis often and unfortunately occurs, can have sleep disturbance. Now, sleepwalking is a parasomnia. That's not an insomnia. Right? So that's a little different. Insomnia is a dysomnia. Right? Dysomnia and parasomnia are the two types of sleep-wake disorders. Insomnia, hypersomnia are problems with the sleep architecture, the timing of sleep, the timing of the different stages of sleep, where the parasomnia focuses on behaviors around or about the time of sleep, like sleepwalking disorder. REM or non-REM? Non-REM. Right. True, that's right. And how do we differentiate sleepwalking disorder from REM sleep behavior disorder?
You recall your dreams and REM sleep behavior disorders.
Right. So REM sleep behavior disorder is likely to manifest looking similar to sleepwalking, and maybe that's what's going on here. But the polysomnography will reveal that the individual during REM sleep continue and pathologically has muscle tone. There isn't apnea during REM. And because they have sustained muscle tone during REM, and that's pathological, they can actually walk during REM periods. So they will remember their sleepwalking, even though it's not true sleepwalking disorder. This can be induced by medication. Which medication is most likely to appear in the shelf exam as a substance-induced REM sleep behavior disorder, if there is such a thing? Ambien, Lunesta, and Sonata are the three that come to mind.
So the hypnotics.
Again, despite the fact that Donnie takes 2 tabs,
That's like, wow.
it doesn't end in IM. Anything else here? By the way, in addition to everything else that we're discussing and how to approach what looks to be Donnie's first break psychotic episode in the setting of new onset schizophrenia, he would need a polysomnography too. We want to make sure, or we want to understand, is he quote unquote walking during REM or non-REM periods? By the way, if he's walking during a REM period, what might be a treatment of choice?
So, benzos.
Benzos? Potentially. Something I think might be more first line. What type of mechanism from the medication are you looking for?
Something sedating.
Something sedating, more specific.
Something that decreases the REM latency.
What about antihistamine?
Or, what's the other receptor that's right near the antihistamine?
Cholinergic?
Exactly right. Right? REM is a cholinergic phenomenon. So if you want to disrupt REM, you will prescribe an anticholinergic. What is the most anticholinergic tricyclic? You know this. Look at your screen.
Doxepin.
Boom. So maybe they got the polysomnography already. And maybe they ruled out sleepwalking disorder. And maybe they did discover that Donnie has muscle tone during REM periods, and the treatment of choice would be doxepin. By the way, what's the other sleep-wake disorder that is a REM pathology also treated with an anticholinergic, specifically an tricyclic antidepressant, I should say. Narcolepsy, yep. Narcolepsy, we usually prescribe 2 medications. We give the tricyclic at night for that very reason. And then when they wake up in the morning to address the excessive daytime sleepiness, we give them a stimulant like Ritalin. Or some other non-addicting or non-stimulant dopamine agonist. Which we don't see here, so I don't know if this is truly narcolepsy. Other observations about Donnie. So, again, turning our attention to the psychiatrist and then others that would be in what we would refer to as psychiatrists as his social support system. Are there any that demonstrate behaviors that are as off-putting as those from the psychiatrist?
I don't know if this is related, but it reminded me of like at the end of the movie, he's like laughing, like while he like wakes up or is about to sleep or something, and that's like, would that fall into like that? In narcolepsy, you have that happen where you're like laughing when you're waking up or you're going to bed.
It like induces the narcoleptic episode when you're laughing.
That's like
Cataplexy.
yes, that's like
Cataplexy, yeah.
But I also think that's like part of that sleep.
Oh, hypnopompic.
Yeah, you know, hypnagogic.
That's more
Hypnagogic.
Perceptual disturbances, not laughing. So I think there's 2 things going on here. With regard to narcolepsy, you can have visual hallucinations either upon going to sleep, hypnopompic, or even waking up, hypnagogic or gogic. But then there's also the phenomenon that individuals can actually have a narcoleptic episode, a drop attack, during high stimulus situations such as laughing. So they're 2 separate things, albeit from the same illness. So Donnie's, upon awakening, laughing is backwards. We should have him laugh and have a drop attack. So Donnie's social support. Any characteristics that are as off-putting as that described or observed in his psychiatrist?
His dad finds a lot of his occurrences pretty funny.
Yeah, you know, that one scene in the car when he's actually trying to, if not rationalize, put some kind of a spin on it, makes a comment along the lines of, you know, when I was your age, I was kind of a rabble-rouser as well. I'm wondering if that actually points to a history of bipolar. Right, and again, it's more of a clinical parole than it is on your shelf exam, but you should never rule out bipolar upon meeting a person for the first time. Because a manic episode at any point in their past rules them in. And even in a comprehensive 60-minute psychiatric evaluation, you may not get all the information, especially that at or around the time of the patient being 16 or 17 years of age. And they're not disclosing that prior manic episode, they simply be because they just don't remember it, where their parents or their cousins or their loved ones, etc., might. So I wonder if that's what we're hearing from the father. that, not Donnie per se, but when he was Donnie's age, he had something very similar because there is a significant degree of heritability for bipolar illness. So that must be, that is in our differential, but this only confirms that it should remain in our differential diagnosis. Right? So yes, the dad.
Does he have he also has problems with authorities, like oppositional behavior, and he had previously burned a house down, which
Yeah.
is why he had it.
So, like any personality trait that appears to be maladaptive, the clinician must always investigate that behavior is not in the context of a larger disorder, substance-induced, medical condition, or mental disorder. So if an individual is either manic or psychosis during a break of schizophrenia, they can absolutely demonstrate that behavior. And if so, number one, we have to assume as such before we have to rule it out. And until we do, we're probably not going to talk about something like the antisocial personality disorder. In individuals with schizophrenia, and part of this is due to the fact that individuals with this condition very frequently have cognitive deficits that are similar to dementia. The original description of this condition was dementia praecox, dementia in 25-year-olds and 17-year-olds. Cognitive deficits. Sometimes individuals with schizophrenia, due to those cognitive deficits, can't communicate verbally to a point where disorganized speech might be part of the picture. In such cases, they may be communicating or opt to communicate non-verbally. And one way can be through fire setting. When that happens, the clinical term is called communicative arson. It's a nonverbal expression of an individual's inner feelings when, due to cognitive deficits, they cannot express themselves verbally. So whether the person has true disorganized speech or not, they still might be using non-verbal means to communicate. And one example of that might have been Donnie's burning down that school. Was it school?
His house.
The house. I'm sorry, it was the pedophile's house. The school was the water main break. I don't know if there's such thing as a communicative water main break, but communicative arson is a thing. Any other characters here? Do you like his teachers? Is something wrong with these people? I mean, one of his teachers gives him a book on time travel, despite telling him, if I'm caught giving you this, I'll be fired. I love you guys. I will do things, write your letters to make sure that you have the best career you ever have, but I will never hand anything to you thinking that it might get me fired. But he does. What's wrong with these people? How about his wife? What are the odds of somebody coming through that door right now and my telling them, sit next to the student you think is the cutest? Now, I know this was made back in around 2000, and it's 2021 and things are vastly different now. However, even back then, I would not be quite dead saying that as a faculty member of Rutgers, the State University of New Jersey. What is she doing? How come the gym teacher all of a sudden has a newfound lot in life to somehow protect the pedophile? What about the pedophile himself? Is there anybody in this movie, anyone who would be considered part of Donnie's social support that isn't acting this way? Gretchen. So, the camera's off of you. Simple question, you're only allowed to say yes or no. Don't give me another syllable other than yes or no. I'm going to actually go around the room now. Right? Yes or no, do you like her? I don't care what you think she has. I don't care about your most likely diagnosis. Do you like Gretchen? Yes or no?
Yes.
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 Two yeses.
Yes.
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 Yes. Yes.
Yes.
Yes. Yes. Everybody likes Gretchen. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 12? Yep. 12 for 12. Good for Gretchen. All right. Anything going on with Gretchen here?
That's probably as now we can say more than one word.
Yeah.
She probably has some PTSD.
Right. The timing would certainly support PTSD versus acute stress disorder. Right. Seems to be hypervigilant. Blunted affect, blunted response. Negative affirmations about oneself. So yeah, I could see acute stress disorder or post-traumatic stress disorder being the differential here. Anything else? I'll give you a hint. We actually mentioned it in this morning's discussion of Seinfeld as a diagnosis. Nobody remembers it. Nobody was there?
Never there.
You guys just put your avatar up there. Louder.
Malingering?
One more time.
Malingering.
Malingering. All right, so who here did the deep dive? When Donnie Darko ends, the movie ends, and the credits roll, were you guys really comfortable in understanding what just happened to the last 90 minutes of your life? No, there's not a single person that could look me in the eye and say yes. How many of you, upon having that feeling, decide, okay, it's time to actually go get on YouTube and Reddit? All right, we have one. We have a couple. All right, so what's your find? You find anything on Gretchen?
No.
No.
No kidding. Did you find something published by Grandma Death, Roberta?
Yes, I was
Sparrow?
going to buy it for $10.
Huh?
I was going to buy the book for $10.
That was the one.
I actually have the PDF version of it posted on Canvas for you. So save time. I'll remind Kathy later. Okay. What's the philosophy of time, John?
This is tangent universe.
Primary universe, the artifact.
Muscle.
It's evidence that a tangent universe has spontaneously come into existence by evidence of the artifact. All right. Unfortunately, tangent universes are unstable and implode in a very short time, 28 days plus. What will stop the tangent universe from imploding, creating a black hole through which all of our existence will cease?
Has to be made equivalent.
Huh?
Has to be made equivalent.
What do you mean?
Like it's missing a part.
What part is it?
The airplane.
Yeah. All right. So here is the philosophy of time travel understood, how it applies to Donnie Darko, the film, and how it changes the film. We know that there's evidence of an artifact. And we know the artifact, by definition, will be metal, and is the evidence that a tangent universe has spontaneously come into existence. We know that the artifact is discovered by someone who then is called a living receiver. The living receiver will have one lot in life, one mission, and that's to return the artifact into its original position. Otherwise, our universe will implode. Now that's no small task. And as a result of the stress that's imparted by that very task, it circles back to something that we again discussed through Seinfeld, and that is this condition called stress-induced psychosis. So now I have to ask the question, we were spending the last 20 plus minutes here talking about Donnie Darko, the character, as a fictional case of first-grade psychosis ruled out schizophrenia. But might this be stress-induced psychosis because saving the universe is a stress? Right? Again, stress-induced psychosis means that given the level of stress, anyone can become psychotic. And if you read philosophy, written by Roberta Sparrow, she actually gets into that people who are now deemed the living receiver will present irrational and look psychotic due to the nature of their mission. Right? So maybe that's what this movie is really about. Now, Donnie will be supported in this task. He's supported by what we would refer to and have discussed as his social support system. And along these lines, we know that there are two types per Roberta Sparrow. That is, there is the manipulated living and manipulated dead. Manipulated living are individuals in Donnie's life who understand they have to get him in a certain position by the end of this movie and know that if they don't, something bad is going to happen. But they don't know exactly what. Individuals, his social support, provided this task, will behave irrationally. They will give him books that can get them fired. They can say things like, sit next to the cutest boy in the room. They will prescribe him placebo and not contact the police or 911, acute psychiatric services, when they, that is Donnie, poses an imminent danger to himself or others. That's the level of being irrational. And that clarifies why all of these characters are acting really goofy. The other part of Donnie's social support, manipulated dead, are people that in the tangent universe in this entire movie, except for the first 2 minutes and the last 2 minutes, is set in the tangent universe. And anyone who dies in the tangent universe becomes manipulated dead. They have the same task, support Donnie to make sure that he sacrifices himself for the universe. But they have full clarity of what's going on. That, of course, includes Frank, our lovable bunny. And many people, upon reading philosophy and understanding Frank was manipulated dead, get it. And they have no problem with that. They're like, oh, I knew that guy was bad news. But then there's another character that dies in the tangent universe. Who is it?
Gretchen.
Gretchen. And that's when you discover that everything that Gretchen does and that everything that Gretchen says throughout the entire movie is a lie. It has one objective, to make sure Donnie dies. She never liked him. Her father's not back in town, and quite frankly, never abused her in the first place. She wasn't sleeping in that theater. None of that is true. Malingering. That's Gretchen. And you all liked her.
Dr. Tobias, it's 120, by the way.
120. All right. So we'll end it there. Again, malingering again ties back to George Costanza. Somehow making, of all things, Donnie Darko relate back to the caddy. Our discussion this morning in Seinfeld. Any closing comments or thoughts? We're good? All right. Well, good luck at PCM. Have a great weekend. And tomorrow, latest, I will post what next Friday's films will be.
Bunny's Frank.
Yeah.
Frank, yeah.